Well, hello, everybody. My name is Garrett Schmidt. I'm the managing editor for BBC Exhibit Hall, and I'd like to welcome you to today's live webinar that is hosted by BioReference, and it is titled How Transformative Laboratory Services May Close Gaps in Care and May Reduce Cost. And we've got a lot of great information that will be shared today, so glad that you're here. A few items of note before we get started. Everyone has joined today in listen-only mode. This is a traditional webinar format, so you don't need to worry about muting your microphone or your camera or anything like that. However, we do want to hear from you. During the Q&A, we're going to have some time to actually take some audience questions. And so at any time during the presentation, you can go ahead and submit a question. And the way you do that is you use your audience. You all have an attendee module that has a questions spot on it, which is different than the chat. So just make sure to use that questions module. We should have enough time, but if we don't get to your question, then someone will get back to you with an answer via email. So just keep that in mind. So even if we're wrapping up, go ahead and ask your question. Again, we'd love to hear from you. And then finally, today's session is being recorded. So what's going to happen is when we're done, you're going to receive an email maybe about an hour or two after the conclusion of the presentation from myself or one of my team, and it'll have a link to the recording where you can watch it and rewatch it and share it, as well as a place where you can download the slides. So you should be able to have that, and that'll be for everyone that registered, even if you're not able to hang out to the very end. So without further ado, I wanted to briefly introduce our speakers today. We have Mr. Carlos Acosta, and he is the Director of Product Delivery. And we have Merv Oscus, who is the Chief Information Officer, and Michael Nair, who is Head of Product. So I think Carlos is going to get us started, so welcome.
Good afternoon, everybody, and maybe good morning to some folks on the West Coast. Thank you, Garrett. We appreciate your time, and we appreciate that introduction. Thank you, Michael. Thank you, Merv, for joining us. And we'll dive into it a little bit. Currently, my role is that of Senior Director here at BioReference, focusing on value-based care initiatives, working mostly with large medical groups, accountable care organizations, IPAs, MSOs since approximately 2017. BioReference shares a really strong commitment in serving the needs of patients and providers through the entire continuum of care. So it's been very successful in building relationships with many BBC organizations and risk organizations nationally. So it's always a fun thing to do. It's great to meet so many different organizations and leaders through the different regions and the different states and work with them hand in hand. So for some of you who aren't too familiar with BioReference, we'll just start with a brief BioReference overview, the value of BioReference, and then the exciting piece of the presentation, which is the connectivity and analytic solutions rolling into our Global Care Index dashboard and platform. And we'll finalize it at the end with a little summary and some questions and answers for any of you. So a brief overview of BioReference's background. We're a 40-plus year organization, sustained growth with great expertise in the clinical diagnostics. We're one of the largest full-service commercial laboratories in the United States. Sometimes that comes as a surprise to some folks, but we're one of the top 5. We have a presence in all 50 states with some of our core laboratories in the Northeast, in New Jersey, in Houston, Texas, in Central Florida, and out to Southern California also. We have some areas and some verticals of expertise, and I'll speak briefly on them a little bit later, which is in oncology, our women's health division, and our urology. And currently, I think through last year, we processed over 20 million specimens on an annual basis. And as you can see, with most of our test menu, we have a test menu of approximately over 3,000 tests, and 99% of all that ordering tests that comes into our facilities nationwide are performed in-house. So as I mentioned a little bit about our 3 verticals and our specialized brands, the first one is GenPath Oncology. GenPath offers a comprehensive portfolio to support the continuum of care for cancer patients, from risk assessment to treatment planning. And it's backed by a really good team of specialized pathologists. And I'll go over a little bit of what that team consists of and so forth. Our GenPath Women's Health, another division where we are the gold standard in women's health testing, where we provide end-to-end laboratory solutions and testing for all women from every stage in their life. GenPath Women's Health offers testing for cervical, vaginal health, reproductive health, and hereditary cancer screening. Our GenPath Urology, it's cutting-edge uropathology, including our FDA-approved prostate cancer biomarker test, the 4K score test. The 4K score test is a proprietary test for BioReference, and it's a fast-growing test since it was FDA approved and launched a few years ago. It helps assess the probability of finding aggressive prostate cancer in men, and it utilizing a second decision point prior to a prostate biopsy that will help men and their physician and their provider decide the next steps along their journey through that prostate. So a little bit about the value of BioReference and value-based care. As I mentioned, throughout our 40-year legacy of proven science and comprehensive expanded test menu, from your basic routine testing to your primary care physician, all the way through esoteric testing and genetic testing, are areas of our expertise throughout the years. We currently serve many of the largest ACOs in the country. As I referenced earlier, to me, it's really exciting to be able to travel to different states and different regions, working with leaderships across the different ACOs and value-based areas in the arena, whether it's an MSO or an IPA, and see how they all have different dynamics. Always the same end goal by reducing cost, expanding care, but different dynamics depending on the regions and the geographical areas and their patient population that they service. And we're in network with the largest health plans in the United States. I think it's a great value we bring. One of the previous slides mentioned we're in over 80% of all the national payers. When we look at some of the organizations in the Medicare Shared Savings Program, and as an ACO, sometimes it's, when we partner with these organizations, we're partnering at the organizational level with whether it's data, test utilizations, the various solutions we bring. But we're also able to work with the providers independently, not only on their MSSP assigned lives, but through their other patients. A lot of patients, depending on the geographical area of these physicians, they'll be servicing patients that might be United, might be Aetna, Cigna, whatever those provider bases are, those payer bases are in the different regions they have, always makes up a big portion of their patient population, of their payer mix. So by being in all these national plans that we participate in, and many of them we're preferred status, it helps us bring all our services and solutions to those providers, in addition to what we offer them as being a participating provider in one of the organizations. As we mentioned, we have laboratory locations nationwide with a vast majority of patient service centers. Another area of strength that we have and makes us very nimble with our patient service centers is the fact that when we partner with some organizations and they have a need in a particular area for draw sites where there is a weakness and they might struggle, if it's a rural area or something outside a particular metropolitan area, we work hand in hand to be able to analyze and assess if a patient service center is needed for that organizations, and we jump right in and we're able to build them and make sure they're available for their network. And as mentioned, we have a large medical staff comprised of many professionals, over 30 board certified pathologists, over 10 certified genetic counselors, and our customer service excellence team is always available 24 hours, 7 days a week. And of course, we are CAP accredited, CLIA certified. All our facilities are CAP accredited, no matter in which state we are located in. And like every healthcare entity, we're always, being supported by our scientific and our medical directors and our staff to continue to make strategic investments in new technology. And not only new technology, if it aligns with testing, or if it aligns with some type of support that's more analytical. As we know, 70% of most medical decisions are made based on laboratory results. So with that said, I'll move over to the next slide. And some of the benefits we provide to value-based care. Multiple, but some of them, what we're able to bring in with our solutions. Revenue optimization, which is always one of those boxes that everybody wants to check mark off on all the organizations we partner with. Our value-based care management approach and systems that we're able to support. Rapid implementation. One example would be if we look at an organization specifically, we'll use an ACO as an example again. They have multiple providers, and the platforms on those EMR could be multiple. Every physician can have a different EMR. Through our advanced IT team, we have the ability to really commit and come through with some really rapid implementation of bi-directional connectivities with those EMRs. Just like if it would be a large medical group and they use a community EMR, we have the ability to make that tie-in very rapidly and just add on every care center or every practice at a very rapid rate, sometimes in just within days and weeks. Data and analytics, we'll speak a little bit about that, take a little bit deeper dive shortly around data and analytics and all the innovations that empower transformation to value-based care. We know the large emphasis we have right now within healthcare to switch and take our whatever it is we're offering, every healthcare provider or other institution, from a fee-for-service model to either bundled payments or value-based care. So a little bit about our approach. I always say we're physician and we're patient-centric. We're run by physicians. They have a very specific provider and patient approach to everything that BioReference does. It's not always about a lot of testing, but it's more about the right testing at the right time for that particular patient. The ability that we have for personalized diagnostics, for the personalized management of that delivery of diagnostic information, medically necessary testing, not simply more. We assist with utilization reports, queries by CPTs, ICD-9, so anything that can be actionable for our partners in our value-based care organizations. And also the ability for the actionable clinical data at the patient level. We have a very, very robust patient portal. We won't be touching on that on this particular webinar. I know we talked about it on one last year with some of our other services, but a very robust patient portal that really empowers that patient to be involved in his care and his management of his laboratory piece. So it's something very robust, and hopefully you'll be able to have the opportunity if you visit our website or you reach out to us via email or any other ways through Garrett's team, that we're able to share that information with us, because I really do believe it's very robust and it engages the patient. Again, the patient-friendly portal and results that we just presented, and our genetic counseling support. We see this as an area of growth, particularly in that PCP model lately, where we're seeing a little bit more utilization in genetic testing. And our support team, our counselors, do a great job to work not only with that provider who is ordering and upfront with that patient of that testing, but also with the patient and family of the patient. So our genetic counseling really does a full-scale approach from the provider and also the patients. Our community engagements, we work a lot with some of our organizations depending on their geographical area. We have some large organizations in the Northeast that have communities that are focused, they're Chinese communities. So we're able to provide marketing pieces, information, and everything to those organizations to be able to help them serve their patients in their native language. In Florida and in Texas, we have a lot of organizations that work with large Hispanic groups. Their communities are the patient population is largely Hispanic. We have one of the only full laboratories nationally, which is catered to the Hispanic community, our Laboratorio Buena Salud division. So we also provide information on heart disease, chronic kidney disease, diabetes, men's urology, prostate cancer, in the native language of the communities that our clients are servicing. So it's another plus that comes for some of the approach that we provide to our partners. So connectivity and analytics solution. Now we get to, I think, the interesting piece. And at this point, I'll let my colleague Mike chime in a little bit and talk a little bit about our two platforms, our Global Care and our Insight DX. And Mike, if you would, please.
Excellent. Thanks very much, Carlos. So among all the offerings available to BioReference clients, as Carlos mentioned, Insight DX and our Global Care Index are probably two of the most powerful solutions for practices and organizations like ACOs or MCOs. But what are they? Insight DX is our cloud-based ordering and resulting platform. You can kind of think of it as our provider portal. It's an easy-to-use web-based solution that, among other things, it allows for order creation and the review of test results. It can function as a standalone solution for our clients, or it can integrate with EMRs and practice management systems. The Global Care Index, or GPI as we call it, that's our analytics engine within Insight DX. It uses predefined or canned reports or custom reports that you could easily build yourself to analyze result data for a patient population. And with that, with GCI, you're defining the actual patient population that you want to report on. So whether it be all of your patients or a subset using criteria like age, gender, or any other demographics, combining that with specific analytes and the result ranges that you want to report on, that's the power of GCI. So if we can go to the next slide, Carlos. So what are some of the benefits of GCI? Go to the next one. The primary goal of GCI is to close gaps in care and to really overall improve patient care through better access to data. So by being able to easily view results for data for specific analytes and patients over time, our clients are better able to manage the frequency of patient visits to help ensure those sick or at-risk patients are getting the care they need. They're able to better manage their practices and organizations by having a single centralized system with result data and analytics. And through this improved visibility into data like result trending over time, for example, our clients are better able to adjust treatment plans for their patients. And ultimately, all of this hopefully results in improved care for the patient and cost savings for the practice. So that's a high-level overview of GCI, of the Global Care Index. I'm going to pass it back to Carlos so you can take us through some use cases and some of the actual reports.
Thank you, Mike. And as Mike mentioned, some of the highlights of GCI, we'll dive in a little bit to some of the reports so you can kind of get a little bit of overview. But GCI empowers practice management and patient action tools. It helps benchmark, it'll help track and trend laboratory data in every direction. We know, as we mentioned earlier, 70% of all medical decisions are based on laboratory testing, and GCI is a great platform to help in that area. It'll identify at-risk patients. It'll help in achieving performance goals. It'll definitely facilitate patient follow-up, giving all the patient demographics that you'll see in some of the slides that are to follow. And it'll help in improving patient care and the practice operations. And obviously throughout that spectrum, evaluate and track any disease progression. So focus primarily on chronic diseases to track and trend, as we mentioned. It allows patients to across locations and provider and patients. So the platform allows a care coordinator or a care manager, whomever is in charge of a care coordinating, let's say, area within a particular organization, whether they're monitoring diabetes, chronic kidney disease. It allows them to give them a very detailed and granular look of this data by provider, by patient, by insurance, so multiple trends. It helps them with their practice management reports, the patient's disease, how they're being monitored. It'll also help them give them a very detailed look on patients with multiple chronic diseases that we'll see in the slides to come. And it'll help the practices and the care coordinators assess who are those at-risk patients. Should they be reevaluated? Should they not be reevaluated? And then, of course, the action reports. They help manage patients' cumulative results by specific disease. You can manage the patients at risk, gives you the information to be from the patient's demographic to be able to do callbacks. And it has the ability to give the care coordinator a 12-month window. All the reports are able to be customized by changing the date range, whether it's 30 days, whether it's a quarter, or whether it's a year, and allows you to give a high-level overview of a whole 12-month spectrum of that care and that disease management for those patients. Obviously, some of the disease states that are monitored, as listed are really, as we mentioned, diabetes, CKD, hyperlipidemia, CHD, infectious diseases, we have cytology, pathology, and in some practices, the anticoagulation management, depending on the specialty of the practice. And as we all experience within value-based care, we know the emphasis on improving care, improving reach, and reducing cost. And if we look at CMS's information, the annual cost, we can see that close to 40-something% of their cost is being spent on patients that are diabetic, that have kidney disease, and have some type of heart disease or heart failure. And when we look at that 40-some-odd% of that population, when we look at the total dollars, it's upwards of 70%. Again, diabetes taking that larger spectrum of that funding. And then we have heart failure, heart conditions, and we have chronic kidney disease at 17%. So it's easy to see why these three categories, these three disease states, usually are always the most that are focused on by organizations in value-based care. So as we dive in a little bit to the Insight DX and our GCI report, which is where it lives inside Insight DX, this would be the page where you would access our Global Care Index report. And in this particular scenario, for demonstration purposes, there's several analytes. So the client has the ability to save, to create favorites. So here we have 3 favorites. We have 3 sections, the one labeled vitamin D, hemoglobin plus abnormal, and hemoglobin. What does that mean? That in that first report that is saved as a report inquiry, the care coordinator has the ability, they're searching for any vitamin D that's abnormal, basically out of range. Same thing with the second report. Any glycohemoglobin that's out of range, that falls within outside that reference range into abnormal. And then the last report is a little bit more specific. This would be a care manager that's currently looking for a specific result on that glycohemoglobin. They want to just identify any result above 7. In addition to that, they have some secondary analytes, as you can see, that will show or will be in the query as the primary analyte. As they set up, we'll also be able to give them a little bit of a high-level look on these secondary analytes. So completely customizable, completely automated. You can save your favorites, save your searches, and go back every 30 days, every week, whatever time frame based on the program that's implemented in your organizations to be able to monitor these inquiries that have been set. So here's our first example of an inquiry. So what we're looking at here is a result of patients resulted one time by practice. So as I referenced earlier, the system has the ability to pull results by practice, by location, by provider, by insurance company, multiple ways. And in this one, we can see that our first row here highlights for us the patient count. And it'll add up the patient count for each one of the practices on a monthly basis. And as we can see this particular practice on a monthly level, what amount they had on the threshold that the report was set of every patient with a glycohemoglobin greater than 7. On the bottom piece of the reference, we can see that it'll always break down how many patients from this query and at what value. In addition to, it'll present it in a graph. So very simple way to manage office visits of sick patients, or in this scenario, at-risk patients when we're highlighting and focusing on diabetes. It's one of the multiple views that the system gives you of data to be able to break down by practice. On the next slide, it gives us the view of the same query, which is a glycohemoglobin above 7, but reported one time. And this can be done by provider or it can be done by practice. So this is where the report gets a little bit more granular and turns it into part of its actionable data, because here we can see the individual patients. We can see here they've been scrubbed on the left, but these represent individual patients. It would come up with a patient ID if it's assigned in your EMR, the patient's date of birth, the patient's phone number, and the collection date. So this is a great tool to highlight those patients at risk that for some reason have only been resulted one time. and have not been back. And it also highlights what those results are. And the report can be extracted into an Excel spreadsheet, PDF, multiple ways, so that directly from this report, your care coordinator or anyone in an office does not have to go back to that patient's EMR, go into their demographics and figure out who Jane Doe is, what's their phone number. So it'll extract all the information that we have on that patient and be able to provide it. So it definitely can be something that's resourceful and useful. Now, on the next slide, another one of my favorite reports is multiple times. So if we're using the same format, right, the same query, we're still at the query of glycohemoglobin resulted higher than 7. So if we look at the first patient, we can see that in October, this patient resulted at 5.3, but in April resulted at 5.6. So we see it trending in the upward trend here, just like we have the ability to see it in the opposite way. If we look at patient 5, you can see in mid-month they had a 6.0, a few months after 5.7, so patient trending down. So the beauty and I think the power of this report, that it really allows a provider or a care coordinator to have a broader view of that patient with this particular analyte that they chose throughout a 12-month period to see, as we mentioned earlier, tracking that trend to see in which direction it's going. So it helps them definitely identify those patients that are in need of a follow-up treatment or haven't been back to the office, whatever that scenario may be. So here we have the same primary inquiry, which is a glycohemoglobin above 7, but with the secondary analytes, as we saw on that dashboard a few slides ago, that this person had the ability and created a query adding a secondary analytes to eGFRs, the BUNs, the creatinine, the LDLs, and their glucose. And again, it highlights that date range that they put into the query. It gives them their primary analyte, and it allows them to take a nice high level and almost and granular view to this report, because it's also providing the actual patient phone number, date of birth, and patient ID, which is being pulled from the EMR. So it's a great way to evaluate patients with the potential of multiple diseases, and it allows you to track, again, as in the previous, but a little bit more detailed with the secondary analytes, the progression across different conditions. And I believe one of our final slides here on the practice summary, this one is an example of practice summary resulted once and multiple. So the top half of the report will give us the total of the patients, since it's a practice summary. So if you are a large medical group and you have 12 locations, you have the ability to have that high level view of every location. This would be a great example, right? This could be by provider, or it could be by practice. In this scenario, we're looking at it by care centers, by practice. So you have the ability to see what that resulted mean is, how many patients fell into this query, how many were resulted one time only, identifying those that would need to come back, and then how many were resulted once, and the number of patients there. And on the bottom graph, it gives us the same view, but with the patients resulted multiple times, more than once. So again, at a practice level, but it helps track consistent patient care. It helps get a good view of patients across multiple care centers or multiple practice locations. So another great tool. A lot of our partners at the very beginning, when we started working with them, really, relied on that feed either from CMS, from a payer, from a state information system, and then they had to manually copy, paste, pivot, and pull all this information together. And the Global Care Index dashboard and the power that it has with its platform, it's really a great tool to help out. And as we can see here in summary, to help improve the patient outcomes, help with the efficient practice management, centralize it too when there's multiple locations, multiple providers. End of the day, improving patient care, identifying these diseases, and improving the downstream cost savings. So with that said, I'll send it back to you, Garrett, to see if there's any questions or anything else that we may.
All right. Well, thank you, Carlos. That and Michael and Merv. This is great. Yeah, we did have a number of questions that came through, so we'll go through these in no particular order. If you do have a question that you would like to ask, you have a control module as an attendee with a little question feature on it. So please go ahead and submit your question there, and we're going to get to as many as we can. All right, in no particular order, let's dive in. First question is, does GCI integrate or live inside of my EMR?
That's a good question. GCI basically is our web-based system, but what it does integrate with the EMR is that it lives inside DX, which is our web-based system. But the application leverages all of its results that pass through that organization. Because being tied into the provider's EMR, or whether it's a large medical group or an MSO that has a community EMR, we're tied into that, being able to pull all the data. But it really lives within our Inside DX web-based application.
Okay, yeah, great. That clears that up. Second question is, how do you identify the attributed lives assigned to an ACO to be able to provide the data?
Sure, Mike, you want to take that one, or would you like me to go?
Sure, I'll take that. So there's a number of ways that we can push results into an ACO. So we basically define an ACO kind of container account in Insight DX, and then either based on a patient roster or a list of providers or a list of specific what we call feeder accounts, we can push those results and kind of copy them into that ACO account so they're all in one centralized place. So a lot of flexibility, a lot of different options to suit your needs, up to including even adding on a payer layer. So if you wanted to filter out by specific payers that patients are using.
Wonderful. All right. Next question here is, if we are overseeing a large group of several providers, how can a care coordinator or CCM team view all of the organization's or providers' lab data?
It's a good question. So I think there's two scenarios. When you're a large medical group or an MSO, sometimes you're a wholly owned entity of all the care centers. So that one is a very simple way we connect all the individual providers or accounts into, as Mike referenced, a master account or a parent account. When we look at an ACO, since there's multiple providers and their attributed lives are assigned to this ACO, that is not the 100% portion of that provider's practice, right? He has could be a small percentage of his patient population. So as Mike just referenced, what we do is we work with our organizations and their IT team, and they'll provide us a list, for example, of the attributed lives assigned to their ACO. And we upload that, as Mike referenced, and that allows a care coordinator or whomever that designated person may be at that organization to view only the population of the attributed lives assigned to the ACOs without having access to any other of those providers' patients.
Okay, yeah, great. All right, moving right along. Next question here is, how does it function within a full risk model like an MSO or Medicare Advantage population?
So I would say the same way. When you have an MSO or a Medicare Advantage plan, usually those lives, again, are assigned to that MSO. And the two, as we've referenced, the two ways to align the patient information is either through tying all the providers together, or if it's a Medicare Advantage plan or a Medicare Advantage group that owns all their care centers, the centers would be tied in just to a central account. And that way it would give everybody or whoever is assigned, you can have a supervisor level access. So you can have, let's say, a care coordinator viewing all of that, of all the practices, but at the same time, you can have a provider or someone in his office only viewing those patients and that data that's applicable to him, not to the rest of the organization. I hope that answers the question.
Yeah, no, I think that it does. All right, next question here is, what is involved in training care coordinators to use the CGI platform?
So it's very simple. Mike, I don't want to be the only one, but I know it's a simple process. I've lived through it multiple times, but you want to chime in?
Yeah, happy to. So GCI and Insight DX as a whole, we've kind of built this to be extremely user-friendly. We work very closely with our customers, and our product managers work very, very closely with all of our clients and stakeholders to get their feedback. And we built it in a way to where it's largely a wizard, right? So you start up the process to create a report. The system will walk you through your options. It's very straightforward, kind of common language. You build your report, you run it, and it's there. So we found that training time is minimal, and the ramp up speed, the ramp up time is very short. We do have online resources as well as human resources available to our clients to assist them where needed. But by and large, we found most people pick it up pretty quickly once they get their hands on it.
Yeah, and usually, my team, since we specifically work with these large, value-based cares, we'll have someone walk. We've done remote, and the remote usually takes 30-minute training of whoever is assigned, or we normally 9 out of 10 times will have someone from our team come into that practice or that person's office. We'll walk them through it. We'll help them set up those first ones, their favorites, and things like that. And as Mike alluded to, we always have 24/7 access. Anybody who specializes with Design CDX within reach to any client. And at the same time, we're always working, and we assign an account executive that specializes in value-based care to the organizations and to the providers for any questions they may have related to it.
And Carlos, we also have specific technical trainers as well who can, as you're aware, who can help when needed.
Correct. We've had, thank you, Rev. We've had scenarios where we've had someone fly into a large group and do a presentation around the product. But I think the key is, as Mike alluded to, it's a very user-friendly platform. I think within a 20-minute or 30-minute demo or what we call, let's say, an in-service or onboarding, nobody is calling back with questions. It's really that user-friendly.
Great, but it sounds like there are resources available if there are questions.
Correct. Always.
Okay, great. Next question here is, can you elaborate on, quote, medically necessary testing, unquote? Does this mean you counsel the PCP ordering a test if you deem it inappropriate?
Can you repeat that one for me? I'm sorry.
Yeah, for sure. And this may be a question we need to get back to you via email, but here's the question. Can you elaborate on medically necessary testing? I guess that was a phrase that you used at some point. Does this mean that you counsel the PCP ordering a test if you deem it inappropriate?
No, maybe I think two things. I think what they're alluding to maybe was the genetic counseling when I touched upon how we help the provider and the physician. So it fits on the genetic counseling side. Yes, we work with the physician on trying to help identify what is the best test for that patient, since there's so many genetic types of testing. So we work hand in hand, but it's up to the physician always to make that order and make that decision based on his clinical evaluation and treatment with that patient. And if it's more about, do we decide what is medically necessary or something in utilization? No, that always, I believe the correct answer is that's up to the provider. We all know that they're always, the goal is to do or perform something that's medically necessary. So we have the ability to run query reports to assist in utilization. But I would want to tend to say, if the question is that part of it relies on the provider.
Okay, yeah, very good. Next question here is, are you able to share any ROI results from using BioReference's connectivity and analytic solutions?
Merv, I'll give them to you. I know I've seen some graphs, some numbers. Do we have anything that could be specific and could be shared?
You have a specific data team. We'll have to get back on the numbers via email, but we do have a specific data team that we absolutely put into use when we're working with our customers in terms of if they need specific dashboards and or elaborate analysis on the data that they're handling.
Okay, yeah, for sure. And the next question here is, can you click on this practice summary to see a list of individual patient this info applies to? And this may be referring to a certain slide along the way. I'll read it again here. Can you click on this practice summary to see the list of individual patients this information applies to.
So we can, as we saw in the previous view, we can see the individual patients from any practice, but I think the question is more specific if we were to click the practice on that screen. And correct me if I'm wrong, Mike, but I think the answer is no, because since we're generating that report at that moment, all we would have to do is go back and query it to be specific to the patients. Is that a correct statement on my behalf, Mike?
Yeah, that's correct. We're generating a report. It's an output of that report. You can even output that data to Excel to further slice and dice it. So it's not very interactive in the report itself, but the report has multiple kind of sub-reports in it that cover the granular patient level as well as the roll up to the practice level as well.
Great.
And I can scroll back if they like, and we can take a view at that report again. But I think the answer is we just have to go back, query it, scroll, action it, and that report will come back and will be populated with all the patient demographics.
Yeah, very, very cool. And if that didn't answer your question, feel free to reach out to us and we'll make sure we get you an answer on that. And then finally, as I like to conclude these Q&A sessions with, if there is a request for an RFP or someone wants to submit one of those, how do they go about doing that?
Just reach out to me. I think we'll have my email on the last slide, or reach out to Garrett. I mean, my email is C as in Charlie Acosta at BioReference.com. More than happy to have a conversation and see how we can help.
Great. Yeah, we'll show that just in a second. Well, that's all the time we have actually for questions today. If you do have a question that you would like us to answer, again, please send that either to us, and I'll show the email in just a second, or you can submit it here. As we conclude, first of all, I want to thank our speakers, Carlos, Michael, Murphy. It was a great job, very informative. Seems like a wonderful platform, a good system here, very clear in my mind. But I wanted to encourage you all to visit vbcexhibithall.com and actually check out the BioReference virtual exhibit booth there. And here's a place where you can look at different resources that they have, read up a little bit more on what they're doing, specifically in the value-based care space. And they've got a lot of great things here. And then, of course, you can be a little more educated by the time you reach out to them, and then Carlos's information is on there. But if you did want to reach directly out to them, feel free to, Carlos, if you could advance to the final slide there. Their information here is, their contact information is on the slide here. So if you would like to reach out to Carlos or the strategic solutions team, or you can feel free to reach out to me. I'm happy to connect you as well to the team. And with that said, I wanted to thank you all again for coming and spending your afternoon with us. I hope this was an informative session for you. Thank you so much, everybody. Have a great afternoon.
Have a great day. Much appreciated.